Why is it like... Why, you little... Such a beautiful moment.
Suspicious baby legs, boils of rage, and that's definitely not how you cut the cord. Get ready to laugh.
Are you ready to laugh?
Because today we are breaking down and reacting to all of the bizarre medical scenes and eye-catching injuries from The Simpsons. Let's dive right in.
Lisa, you don't look well.
Cheeks are swollen. Maybe febrile. Maybe she's got the mumps. Is there any exact treatment for the mumps? No, it's mostly fever control, pain control, anti-inflammatories. Tylenol, ibuprofen, soups.
And your cheeks are so swollen. I think you have the mumps. I'm calling Dr. Hibbert.
There you go. You have to worry about orchitis. You have to worry about oophoreitis, inflammation of the testicles or your ovaries.
Okay. No doubt.
Doctor, I think Lisa has the mumps.
Well, Mrs. Simpson, much as I'd like to rely on your diagnosis, I think it might be professionally derelict of me to do so.
Be prevented by getting vaccinated. It's been around for a very long time, the MMR vaccination. Make sure you do go to your healthcare provider to get the appropriate diagnosis. Sometimes you can have single-side swollen face, which would be a dental infection, facial infection, or an inflammation of just the parotid gland itself.
Yeah, looks like little Lisa has the mumps. I guess you'll be missing a week of school.
Really funny. Okay, in the background, we see School of Medicine. The university should be there somewhere. Everybody's been asking for it. This is my diploma from medical school, so it does say the University of New England College of Osteopathic Medicine.
Now you get rest and have yourself a lollipop.
The lollipop probably has some citrus components to it, probably activate your salivary glands, could cause pain, or it might give it some relief. So sometimes it's hard to know the exact response that you're going to have.
I feel queasy. Don't stop, Millhouse. You're so close.
So really interesting. People feel queasy but grab their stomach. To me, that sounds like you might be nauseous about the vomit plus having abdominal pain. You can have abdominal pain without nausea. You can have nausea without the abdominal pain.
I told you we should have served cake instead of oysters.
Oh no. When you're at big parties, you do have to be careful of food that is out, especially raw food. Sometimes you have to worry about the mayo, potato salad, or macaroni salad if it's been sitting out. Oysters could cause you to get a bacteria in your body called Vibrio, which will cause a gastrointestinal illness, gastroenteritis. Could also lead to severe dehydration and even death. Treatment ends up being supportive therapy, nausea medication, medication for any abdominal discomfort, hydration if you need it. If you can truly identify that it's Vibrio, you might be able to get an antibiotic.
Homer, would you like to cut the cord?
My pleasure.
Oh geez, Homer over here not wearing a mask, not having gloves on. But yes, they do sometimes offer cutting the cord to a family member or whatnot in the room. Of all the many deliveries that I have done, don't recall any family member cutting the cord.
It's so tough you can't cut it. Why is it like... Why, you little... Such a beautiful moment.
This is not how you would do it. You'd actually clamp it, two different clamps that are pretty close together. That way you stop the blood flow when you cut in between that. And you're gonna use pretty sharp medical scissors, so you're not gonna be chomping away at it and it's not going to cut. Oh, gotta be really careful with this. Right away, I think fracture dislocation of the ankle is gonna happen. If that doesn't happen, now you're having strangulation of that ankle, decreased blood flow to the foot, which could cause ischemia. Okay. Whoa, what just popped in his neck? Holy cow, and it was a very disturbing sound.
You see, these boils on Homer's neck are pent-up rage. If Bart's trap hadn't set Homer off, the anger would have overwhelmed Homer's system.
What? Boils of rage. No.
No.
We will refer to them as abscesses, collections of walled-off infections within the tissue themselves, filled with pus, or what we call purulent material.
You mean I shouldn't punish Bart at all?
Why, if anything, he should punish you.
Poor Marge. She seems so stressed, constantly dealing with Homer and his shenanigans. If you're like her and could benefit from a little more chill, you should definitely check out Chillax by my company, Life Happens. Check out Chillax at lifehappens.com or on Amazon.
And I did it all without wasting money on one of those stupid welder's masks.
Oh, come on.
Come on!
How many welders are out there have had an arc burn to their eyes causing keratoconjunctivitis? We'll have people come in screaming in pain. Emergent treatment that we do in the emergency department is pain medicine, numbing medicine to the eyes, which will make somebody feel better. We have to do an ophthalmic exam. In these situations, we'll typically use a slit lamp.
And this little piggy went...
What?
Look, Marge! Maggie lost her baby legs!
Oh my God.
Oh. It's not like losing your baby teeth. You should not be losing your legs.
Come on, get up there.
Really interesting. There are some reflexes that little babies have that make them like super strong. If you put your finger in their hand, they grasp onto it and they literally don't let go, and you can lift them up. Typically, they'll hold right on.
We've got to get a doctor. Absolutely not. No quack Sawbones is going to apply his leeches to me.
Leeches are sometimes used in medicine or alternative medicine. Sometimes it's for like bloodletting, to get blood out of your body. Sometimes to help heal a wound.
Mr. Burns is suffering from what we medical men call hypohemia. In layman's terms, it's quite simply a lack of blood.
Hypohemia?
Damn it, doctor, I'm no idiot. I know what hypohemia is.
Hypohemia. When somebody has a lack of blood, sometimes we'll say hypovolemia. In general, that's a decreased amount of blood volume. Could be related to dehydration. Could be related to decreased amount of blood products that are being made.
His blood type is O negative. It's quite rare.
Oh, O negative. We don't call it that, we'll just call it O negative. O negative blood type can only get blood transfusions from O negative individuals.
I'm B positive. Damn this common gutter blood in my veins.
Smithers, don't feel so bad. After all, that kidney you donated to me really hit the spot.
He has his kidney, even though they're different blood types. So there are scenarios where they might be able to make it work. Immune suppression, potentially. You have to be on immune suppressant medications, different types of other therapies out there. Also, check out my limited edition Dr. ER apparel, available now for a short time only. Once it's gone, it's gone. So grab yours before it's too late at shopdrer.com. All right, well, The Simpsons. I really like The Simpsons, and I love the medical components of it where they make up stuff close enough so we're able to talk about it and maybe add a little bit more education to those brains of yours out there. Definitely check out this playlist right here, binge watch everything. And as always, do me a favor, subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.